Triprolidine, an antihistamine, is used to relieve symptoms of allergy, hay fever, and the common cold. These symptoms include rash, watery eyes, itchy eyes/nose/throat/skin, cough, runny nose, and sneezing. This medication works by blocking a certain natural substance, histamine, that your body makes during an allergic reaction. By blocking another natural substance made by your body, acetylcholine, it helps dry up some body fluids to relieve symptoms such as watery eyes and runny nose. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products, such as long-acting tablets/capsules, are not recommended for use in children younger than 12 years. Ask your doctor or pharmacist for more details about using your product safely. These products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. Do not use this product to make a child sleepy. Do not give other cough and cold medication that might contain the same or similar ingredients. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drops/spray. When taking Histex, make sure to follow your doctor's instructions. Typically, it should be taken every 6 hours, but no more than 4 doses in a 24-hour period. You can take it with or without food, and if it upsets your stomach, try taking it with food or milk. If you're using the liquid form, use a special measuring device to ensure the correct dose. For chewable tablets, make sure to chew them well before swallowing. The dosage will depend on your age, medical condition, and how you respond to the treatment. Do not take more than directed, and try to take it at the same times each day to get the most benefit. If your symptoms do not improve after 7 days, worsen, or if you think you may have a serious medical problem, seek medical help right away. Side effects of Histex may include drowsiness, dizziness, headache, nausea, vomiting, loss of appetite, constipation, stomach upset, blurred vision, decreased coordination, dry mouth, and dry nose or throat. These effects may lessen as your body gets used to the medication. If they persist or worsen, contact your doctor or pharmacist. To reduce the risk of dizziness, get up slowly from sitting or lying down. To relieve dry mouth, you can suck on sugarless hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. If your doctor has prescribed this medication, they have determined that the benefits outweigh the risks of side effects. Many people using this medication do not experience serious side effects. However, contact your doctor immediately if you experience any serious side effects, such as changes in mood, ringing in the ears, difficulty urinating, easy bruising or bleeding, fast or irregular heartbeat, or seizures. A severe allergic reaction to Histex is rare, but seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so contact your doctor or pharmacist if you notice any other effects not listed. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Remember, always follow your doctor's advice and refer to the medication label for proper usage and dosage instructions. Before taking Histex, make sure to inform your doctor or pharmacist if you are allergic to it or have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues. It's important to discuss this with your pharmacist for more details. Before using Histex, be sure to inform your doctor or pharmacist about your medical history, especially if you have breathing problems, a certain eye problem, heart problems, high blood pressure, liver disease, seizures, stomach problems, overactive thyroid, or urination problems. Histex may cause dizziness, drowsiness, or blurred vision. It's important to avoid alcohol or marijuana, as they can make these effects worse. It's advised not to drive, use machinery, or do anything that requires alertness or clear vision until you can do it safely. It's also important to avoid alcoholic beverages and talk to your doctor if you are using marijuana. Liquid products and chewable tablets of Histex may contain sugar and/or aspartame, and liquid products may also contain alcohol. If you have diabetes, liver disease, phenylketonuria, or any other condition that requires you to limit or avoid these substances in your diet, be sure to ask your doctor or pharmacist about using this product safely. Before having surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of Histex, especially dizziness, drowsiness, confusion, and low blood pressure. Children may also be more sensitive to the side effects of Histex, and in young children, this medication may cause agitation or excitement instead of drowsiness. During pregnancy, Histex should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. This medication also passes into breast milk, so it's important to consult your doctor before breastfeeding. When taking Histex, it's important to be aware of potential drug interactions. This means that Histex may interact with other medications, causing them to work differently or increasing the risk of serious side effects. It's important to keep a list of all the medications and herbal products you use and share this information with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Histex should not be used with antihistamines applied to the skin, as this may lead to increased side effects. Additionally, it's important to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. It's also crucial to check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. It's best to ask your pharmacist about using these products safely while taking Histex. Furthermore, Histex may interfere with certain lab tests, potentially causing false results. It's important to inform lab personnel and all your doctors that you are taking Histex before undergoing any lab tests. If someone has taken too much Histex and shows serious symptoms like passing out or having trouble breathing, it's important to call for emergency help right away. In the US, you can call the Poison Control Center at 1-800-222-1222. In Canada, call a provincial poison control center. Symptoms of an overdose may include large pupils, flushing, fever, hallucinations, weakness, shaking, muscle twitching, loss of consciousness, and seizures. In children, excitement may occur first, followed by loss of coordination, drowsiness, loss of consciousness, and seizures. Always seek immediate medical attention if you suspect an overdose. Make sure to keep all of your medical and laboratory appointments. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. It's important to stay on top of these appointments to ensure you are getting the most benefit from your medication. If you forget to take a dose of Histex, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take extra doses to make up for the missed one. When storing Histex, make sure to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom or freezing it. Keep all medications out of reach of children and pets. Do not flush Histex down the toilet or pour it into a drain unless instructed to do so. Properly dispose of the product and it is expired or no longer needed by consulting your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.